brain fog, talk about the chemo fog. The therapies that we do in the office allow us to help treat those neurological problems. I'm also a certified gluten practitioner. We do a lot of work with food sensitivities in our office. We do a lot of work with autoimmune diseases as a whole. But I think the last thing I want to touch on is two doctors that I've trained with. Dr. Kevin Connors is one of the top alternative cancer practitioners in the country. He has a practice in Minnesota at the Upper Room Wellness Center. I still refer him certain cases that he has specific experience, especially the medulloblastoma and other brain tumors. He's got a lot of experience in treating those alternatively. Also, Dr. Karazian is one of the top thyroid experts in the world. He has a private practice in San Diego. He does a ton of research, and he's got a great book. Why do I still have thyroid problems when all my lab tests are normal? And we actually have that book up at our booth right next to the main stage. The model of care in my office is what we call a neurometabolic approach to care. Everything that we do is to treat our patients neurologically, metabolically, in order to help improve their chronic health problems. As we deal with cancer, I need you guys to know a couple things. Most importantly, if it wasn't clear, I am a chiropractor. I am not an oncologist. I do not cure cancer. I am not here to treat your cancer directly. I'm here to help save your life, but I do it a different way. I'm here to work on your body to help accomplish balancing your immune system and getting it to stop attacking where no traditional medical system is willing to look. And I really do exist for those who cannot get help elsewhere. I had a patient earlier this year who was diagnosed with breast cancer last fall. She actually was gardening, and her husband had passed away a couple years ago, and she was using one of his tools, a big stamper, to put down grass, and it came back up and it hit her in the breast. And she didn't think anything of it. She had incredible pain, but she didn't really think anything of it. It was a bruise. A month later, the bruise was still there, and a month after that, it was growing. And she went to the doctor for the first time. The doctor basically said, yeah, it's cancer. And, it's a tumor, it's fast growing, and sent her to the oncologist. The oncologist said, it's not estrogen dominant. There's nothing we can do. No chemo. It was too big for surgery by that point. No radiation. Literally, she was left with nothing because it wasn't the traditional estrogen dominant cancer that the chemos work on. And she actually went through several different providers until she found me. She lived in Columbia, South Carolina. And we do really feel like we were able to help her for probably close to a year beyond what the medical system would have. And unfortunately, she is one of those cases where we did lose her. But the key thing is, you have these patients who are giving up. They're totally lost. And I think the most important thing is we see people as a last hope a lot of times. But these patients, I don't know if I'm going to get your life back, if there's anything that we can do to help completely reverse it. But if the alternative is an 18% chance of success with chemo that's going to destroy those remaining months that you have, there are so many other alternatives that work for you. With that, we all know cancer touches everyone. My aunt, we lost her 7 years ago, started with liver, went to colon. She went through MD Anderson, went through, the best cancer institutes in the country. And we dealt with, she'd come home and she'd have all this great, just false hope. And things were turning around. And then 2 months later, it was right back. And it's just up and down. I truly, genuinely believe if I knew now what I knew 8 years ago, she'd probably still be with us. And just a little background on her, she always had a weight problem. She always felt like it was a sugar issue. I remember we'd have big holidays and she'd make apple pie with applesauce, or apple juice or applesauce as a sweetener instead of sugar. And everything was always that way. The Weight Watchers, and it never worked. Well, I'm celiac. I'm gluten sensitive. My dad is, her sister, or her brother. My mom has some issues too, but obviously that's not a genetic issue to her. We look at my sister. We look at a couple of my cousins. My family has a huge issue with gluten. And I'm betting you anything that if we had looked at food sensitivities, if we had known where to look, I probably would have found stuff years ago, and her life would be completely different today. And a lot of the talks when I come to these conferences are on gluten sensitivities and autoimmune disease. The talks today are not as much, but when we talk about cancer, it is an immune problem. And we have to go all the way back to 1971. President Nixon said we're going to wage a war on cancer. No, I mean, he said they'll ask for an appropriation of an extra $100 million to launch an intensive campaign to find a cure for cancer. It was that big of a problem that he had this huge press conference. But you know what? That was 1971. And if we look at what has happened from 1950 to 2005, you look at heart diseases. The rates of death have gone from 600 per 100,000 down to 211. Cardiovascular disease, you go from 180 down to 46. Influenza and pneumonia from 48,000 to 20. Cancer, 193 to now 183 per 100,000. It has not changed in almost 40 years. We are losing the war on cancer. Now, if we talk about stats, in 71, 1 in 20 people had cancer. Today, 50% of the American population develops cancer in their lifetime. The incidence is up 18.2%. The death rate is up 1.3%. There was an argument on a form of cancer, and I'll touch on it later, it's a statistic in Australia about how they were improving chemos. And there was a huge argument in the medical literature because one researcher said it was a 2.1% increase in survival, and the other researcher said no, it's 2.3%. And this really got them excited. Really? I mean, come on, that's no change at all. So survival rates have not changed in the last 25 years, and everything I do is published, just so you know. Everything that I come from, when I quote stats, when I quote anything, I will try to provide those references for you. So what is cancer? All of the cells in our body are always replicating. This happens all the time. They're constantly reproducing, they're constantly dying. That is normal. Cancer is when a cell stops dying off. The process of our cells dying off, you think about it like your skin sloughs off, right? Your hair falls out. That's called apoptosis. Cancer is when that stops. And it continues to grow and grow and grow. And what we see is there's a genetic link to driving this. And I'm going to talk about two different types of genes. The first one I'm going to talk about is called an oncogene, or cancer gene, if you will. It's a gene that has the potential to cause cancer. Now, in tumor cells, it's often mutated, they get changed, and they malfunction. So, the other gene is called a tumor suppressor gene. These are our friends, because they're the genes that help prevent or protect our cell from degenerating or heading towards that path to cancer. There are more than 100 known oncogenes. Some of the common ones, HER, NU for breast cancer, BCR, ABL, which is for leukemia, lymphocytic leukemia, CMYCs for Burkitt's lymphoma, NMYC for small cell lung cancer and neuroblastomas. We know a lot about the genes that cause cancers. But we also know about these tumor suppressor genes. And then, they detect bad growth. They say, hey, there's a tumor out there, we got to stop it. Some examples of those: P53 prevents replication of DNA that's damaged. It actually promotes apoptosis, it promotes that cell growth. And then RB, or retinoblastoma, that gene actually regulates DNA replication. These are very, very important in our body. Now, a cancer patient has a higher level of oncogenes that are turned on and a higher level of tumor suppressor genes that are switched off. A non-cancer patient is the opposite. They have a higher level of tumor suppressor genes turned on and a higher level of oncogenes switched off. So when we talk about cancer, that's the first thing we have to understand is what's actually happening in our body. Now, when we talk about naming cancers, there are different categories. I'm not going to go into detail on all of them, but cancers are actually named as to the organ that it comes from. So if we talk about if a cancer metastasizes, like my aunt, from her liver to her colon, she has liver cancer. She doesn't have colon cancer, even though it's now affecting the liver. When we have breast cancer, brain cancer, lung cancer, skin cancer, all these different ones, that's the origin that they started at, but it's also based on the type of tissue affected. I mentioned earlier for that patient of mine who had an estrogen affected, or did not have an estrogen affected breast cancer. I'm not going to go into the detail too much on those major categories. I just want to name them if you guys aren't familiar with them: carcinoma, sarcoma, myeloma, leukemia, lymphoma, and then mixed type. And this workshop is recorded. We're recording it again. We do have it recorded previously. We do have DVDs at my booth, which are by the main stage. So all this information is available as well. You don't necessarily have to write anything down if you don't want to. There are hundreds of different cancers in different categories that exist, and they've done a great job of labeling them. But like I said, my goal is not to treat or cure your cancer. My goal is to increase the function of your immune system so we can get your body to have a higher percentage of tumor suppressor genes turned on and a higher level of oncogenes turned off. With that, We're going to find natural protocols for you. We're going to look at your immune system, and we're going to see what can we do to address the why. If you go through chemo, radiation, surgery, and we're going to talk about each of those today, that doesn't address the why. And that's the key thing, is patients, many times you'll see there are certain cancers that, and listen, I'm not against it, and we'll cover that, but many of these cancers you go through and you do those treatments, and then it's a metastasis, it comes back. Or there are other problems that you're stuck with for the rest of your life as a result of it. I want to give you the best chance possible at having a long and happy life, even with the diagnosis that you or a loved one may have. And there are natural protocols that can turn on these tumor suppressor genes, that can turn off these oncogenes. The way we do that is by looking at your immune system. So I'm going to give you an analogy. Okay, my daughter is 7. Let's put her on a seesaw. Okay, and the seesaw's got that very narrow little base, and you've got 2 kids. Well, instead of her, who's 51 pounds, being on one side, let's take a high school football player, put him on the other side, and have him plop down. We know what's going to happen to my daughter. She's going to get tossed up in the air. That's your immune system. And we have 2 halves to it, Th1 and Th2, or T helper 1, T helper 2. When your immune system gets shifted abnormally, you get this big jump. And what happens is Th1 is kind of like the Pac-Man of the body. You've got all those little soldiers going out and eating everything, trying to kill stuff. And then you've got Th2, which makes antibodies. Now, antibodies are cells that remember the bad guys in your body. This Th1, Th2 should always be in balance. So you don't want my daughter and the high school kid. You want to have 2 little kids balancing each other out on that seesaw. In cancer, cancer cells produce killers to your Th1. They cause those soldiers to get diminished. Your body can't protect itself. It literally strikes at your immune system's ability to save itself and be that security guard for you. So how do we fix it? Well, you know what? There are a lot of traditional approaches. You've got chemo, we talked about that a little, radiation, surgical removal. There are natural chemotherapies, and you see the Cancer Treatment Centers of America. You see some of these places that look like it's a great model, and they do massage and sauna, and they may do some juicing and natural eating, and then they do chemo, surgery, and radiation. So you get a little bit, but it's still the same treatments at the end of the day. You've got immune stimulation, immune regulation, detoxification, waveform excitation, big words. I mean, I can show you, in the fellowship notes, you can go through all these different types of therapies that are out there. The key thing is, what do you do? How do you determine what to do? We've got some problems with this traditional approach. First and foremost, the biggest issue we're dealing with as a primary motivating factor is fear. One of my current patients right now, she's a pancreatic cancer patient. She was a patient of mine previously for thyroid problems, and she had diabetes as well, and the pancreas developed. She came back to my office and said, I've got cancer. And they knew they didn't want to go a traditional route, but they didn't know what to do. So they went, they ended up going to MD Anderson, they went to UNC, they went to all these different schools trying to see what treatments are available. And literally, the patient's husband had a tape recorder on him, and he recorded the conversation with the oncologist at MD Anderson. He said it was the worst thing he heard in his life. And some of you may have dealt with this. I mean, it was every possible scare tactic you could imagine. If you don't do surgery today, if you don't do chemo today, you are going to die tomorrow. The same patient, we actually did a test. It was 4 weeks before she went to MD Anderson, and we did a couple tests. There's an antigen, a anti-malignant antigen test, an AMAS test, which is a cancer marker that we look at, and they did that test again, and then we saw before and after, and there was like a 0.04% change in the month that she was gone. So that's really not that fast growing. I mean, it's a pretty slow growing change. And we've got this one that said he had it. He says, again, it's so fast growing. If you don't do something today, you're done. That's it. So fear is such a huge motivating factor. It really is. And cancer surgery decreases immunity. It actually supports cancer growth. I'm going to give you some stats in a little while about that. There's a spread of cancer cells intraoperatively that can occur. You've got the possible removal of the tumor growth inhibition factors. So preventing those tumors from growing, by going through some of these treatments, you're actually going to see those tumors be able to grow more and more and more. And that can actually lead to an accelerated metastasis in the body. So chemotherapy slows down a fast, rapidly growing cancer. What does it do? It suppresses the immune system. And the goal is basically to kill the cancer before it kills you. You're poisoning your body try to get the cancer first. The problem with this approach is everything gets wiped out. Your immune system is just demolished. And even with chemo, even with radiation, there's two cells I want you guys to be familiar with: CTCs and cancer stem cells, circulating tumor cells and circulating stem cells. Now, these two cells aren't eliminated by any of those treatments. In fact, the moment you're diagnosed with cancer in your breast, you have 50% CTCs in your big toe. I mean, they spread that far. They're all over your body. And you may have heard of the term galactin-3. If any of you have had, that's a marker that's often looked at in blood work. It's the same thing we're looking at here. And the cancer's gone, but then they develop cancer years later in another part of the body because these circulating tumor cells spread. Well, again, why did the cancer start in the first place? Even after billions spent, the reality is we're losing this war on cancer. We don't know. So, like I said, it's not just my opinion we're dealing with. And if we look at the research, we've got studies from Brain Behavioral Immunology, 2003, seminars in Surgical Oncology, 2001, Natural Medicine, 95, the European Journal of Surgery and Oncology, 99, Annual Surgery Oncology, 2003, big medical journals. Manipulation of the tumor actually releases tumor cells into the bloodstream. Removal of the primary tumor and therefore lack of factors to inhibit angiogenesis in remote locations, so metastasis occurs. Local and systemic tumor growth factors and tumor-promoting cytokine release from tissue injury during surgery. What that means is you have surgery, so your inflammation ends up increasing, your immune system spikes, and it spreads out to cells elsewhere. How about suppression of that Th1, cell-mediated immunity? Chemo, does it significantly extend survival? And that's the big question. Should I do it? And if you ask me, Doc, my daughter has cancer. Do I do chemo? Do I not do chemo? It depends on the cancer. It really does. That is such a hard thing. A lot of praying is involved with that. A lot of research is involved with that. You need to have all the facts. If we talk about clinical oncology, 2004, 9 years ago, the contribution of chemotherapy to a 5-year survival in adult malignancies. If we look at colon and rectal, from 2000 to 2005, I'm looking at stage 4 here, okay? 8% survival. From 96 to 2002, 8% survival. From 89 to 94, 7% survival. Maybe 9% survival for colon. Actually, you know what? It's worse today for colon cancer than it was 20 years ago. If we talk about the conclusions, a 5-year survival in Australia increased, this study, 2.3%. 5-year survival in the US, 2.1%. Median survival in lung cancer has increased by 2 months in the last 20 years. Overall survival benefit of less than 5% has been achieved in the primary treatment of breast, colon, head, and neck cancers. Those are scary, scary statistics. Now, chemo has helped some cancers. Testicular cancer, Hodgkin's, non-Hodgkin's lymphoma, even ovarian cancer, which is such a low survival rate, but it has increased. The truth is, if you look at the Journal of Oncology, cancer is big business. The Journal of Oncology is a peer-reviewed medical journal. The average cancer patient is worth nearly $300,000. And when you talk about that traditional approach, at what point do you stop saying, let's look at everything that can help a patient, and saying the oncologist just wants that money no matter what? If any of you have gone through chemo, the doctor spends a ton of time with you beforehand. I know this because I talk to patients who've gone through, who've come afterwards, or patients who've seen over the years, even family members. But once you start chemo, it's 8 sessions, intensive, whatever it is, you will not speak to an oncologist again for 6 months until you're done with your treatment. Even if you have a reaction to it, and you say, oh my God, what's going on? They will not see you for weeks and weeks and weeks. You are stuck in a lost maze. Now, everybody knows Suzanne Summers. She's got a great book on curing cancer, right? We've got all these alternatives, and there's all these books written out there on ways to cure cancer. Why is none of it used by our traditional system? Well, it really comes down to who's running our medicine, who's running our medical world. Now, is there really a cure? My colleague, Dr. Connors, one of the best quotes I've ever seen. A serious clinician will come to the conclusion that successful supportive care of someone diagnosed with cancer will be defined as converting from an acute terminal disease to a chronic manageable disorder. How do we get your life-threatening problem under control, and you may be living with it? There's a drug study that's being done now for a possible treatment for breast cancer that they actually had a lady on the Today Show last week about it, where it doesn't cure it, but it may increase and allow you to live with it for the rest of your life. And it's an interesting study because that's the thought process we're looking at here. But there are natural protocols that can turn on those tumor suppressor genes, turn off those oncogenes. Many people don't realize that natural remedies can make a cancer worse. And this is the thing, if used incorrectly, and that patient of mine, the breast cancer patient, she went through an online protocol from a doctor who wrote a book out in Arizona that actually was helping herself. All her symptoms were better, but her tumor was still growing. So she went through a doctor before she came to me in Charleston, South Carolina, who put her on the Hoxsey method. If you've heard of Hoxsey, it's flaxseed, it's cottage cheese, and listen, for certain types of cancer, there's a benefit for that. For her, it made her worse. That's when she ended up in my office. It's very, very serious. Taking the wrong supplement is literally life and death. And we talk about like a patient was taking TH2 support. So a patient was taking what, like pine bark, green tea, grapeseed extract. You know what? What happens is it pushes TH2. Is that good? Is that bad for them? How about patients taking astragalus, echinacea, licorice, maybe vitamin C, maybe IV vitamin C, heavy doses of garlic. It's a TH1 support. Well, not everything needs TH1. You can talk about, my system's doing little things, but you can be taking IP6. Any of you have heard of IP6? How about hyaline 951? How about protocell? Patients can take these things, they hear about them, and they're great for you. How about curcumin? How about colostrum? Vitamin D. These things are great for you, but you can still get worse if it's not for your body. And that's the key thing we're looking at. There we go. You gotta know what the patient's immune system is doing. You gotta know how your supplements are regulating. If we're gonna know how to get you better. And, I do get asked a lot, I have this cancer, what's the best protocol for me to do? There is no best protocol for me talking to you right here now. We have to sit down and evaluate. We have to assess you. And it's off the top of the head, there's nothing that's gonna work. There's so many different approaches. Which one is the best one for you? We're gonna talk about some of them. We're gonna talk about the Gerson therapy. Has anybody here heard of Gerson? Yeah, okay, yeah. So, coffee enemas, if you go to the Oasis of Hope, you're gonna be doing coffee enemas 14 times a day. And you're gonna be juicing basically about 1.5 gallons a day. And that will help certain people wonderfully. But that is not a life. And let's be honest about that. That is an all-intensive 4-week. You don't have a life if you do that every single bit. Now I will tell you, coffee enemas are one of the best ways in the world to boost your liver, to help support your gallbladder. I use them with some patients who have thyroid problems, who have gut issues, who have skin irritations. I can have a patient who comes in who has skin rashes, and that's all they have. They may be doing coffee enemas. And it is a great treatment, but I'm not going to have them do it 10 times a day. They may only get to do it once a week. They may not even be able to get over the concept of what it is. Gerson also does juicing, and the reason for juicing is because of the acidity that exists in your body. Cancer feeds off acid, it feeds off sugar, and if we can make your body more alkaline, then that's going to help you. So juicing is a great way to do that. Vegetarian diet, we talk about acidic foods, red meats. Most meats are acidic. Now, meat is not always bad for some people. And for a lot of cancer patients, there's a happy medium. But red meat usually is a culprit. Usually something we have to talk about itself. Has anybody heard of Dr. Kelly? So this is an old book. We got to go back to the 1950s for this, okay? But it's called drkelly.info. It's a metabolic typing. This is a great program that you can do by yourself. It costs about $35. And it is a book that you fill out, a huge questionnaire. And his organization will help, based on his research, tell you what your diet should be made of. And it helps classify you. There's I think there's like 30 different classes that they go through as far as where you fit in. And it'll help determine what your metabolic type is, so what foods should you be eating and should you not be eating. There's another one, the cancer diet. It's a book, New Eating, God's Way for Cancer. And it talks about grass-fed only meat, it talks about something that's high in protein, omega-3s, no meat for the first 12 months, if the patient is sympathetic dominant, that's the immune system. Bone broths, wild game is good for you. I mean, they really talk about, very specific stuff here. And what we're seeing is, even fish, they talk about wild caught fish, but it must be fins and scales, so they say no catfish. Well, how much of that is just a religion concept, and how much of that is really specific for what you eat? There are so many different diets, plans, and protocols. The Bugwood diet, eating God's way for cancer, Kelly's enzymes, Gonzalez, mega dose vitamins, vitamin C IVs. Talk about Gerson therapy, SCIT is another one. You talk about Dr. Simoncini. He's an interesting fellow. He's Brazilian. He was a minister who went to Brazil and went to these orphanages, and he cured, I mean, he's got a book, and he cured these people with fungus, with mushrooms. And it's actually really fascinating to read the stories that he was able to do. And then you talk about things that have happened. Poxy, talk about Clark, parasites and flukes. You know, how do you determine what to do? My approach is an integrative approach. One thing is not your only pathway. You have to look at the individual patient and determine what you need. And you know, cancer is the ultimate chronic illness. Your body's been sick for so long, and you know what? Now you have a label that you can call it. What you have is the web of physiological dysfunction. And everything you're dealing with that led to that immune problem that we call cancer comes from all these different issues. You have to address what's driving you in order to get your body to calm down. There are health breakers that we look at. The gut function. You know, 80% of your immune system is in your gastrointestinal tract. So if you have a Th2 dominant immune problem like cancer, then you gotta look at your gut. You know what I do with bowel problems? How about that? I have no constipation, I have no diarrhea, doc. You know, it can't be my gut. Well, your immune system's in your gut. And there are tests that we can do to see what's going on. We're looking at leaky gut syndrome, intestinal permeability, food sensitivities, stomach acid, low stomach acid, bacterial issues, parasites. A lot of infections have been linked towards different types of cancers. Blood sugar dysregulation, another big one. Diabetes, insulin resistance. You know what, the doctor says I've got insulin resistance, it's borderline, he's watching it. Well, what's he doing to fix it? Well, he's watching it, you know, and it's inflammation, autoimmune diseases, Hashimoto's. We'll talk, you know, this afternoon I'm going to do the GMO lecture, and we're going to talk about how GMOs affect your immune system. But I mean, you know, if I asked you guys to name 5 autoimmune diseases, most of you would be hard pressed to name 5. And it's really crazy because autoimmune disease affects more people than cancer. And yet it's ignored. You know, I mean, you think of MS, rheumatoid, Hashimoto's, Graves' disease, you know, psoriasis, how about glaucoma? You know, the list goes on and on, and you don't even realize it. Brain, neurotransmitter deficits, anemia. You know, you can have problems with your white blood cells, your liver, your gallbladder, your thyroid. You can have issues with fatty acid metabolism. All these things are health breakers that we have to correct. How about you can have a problem with taking food in and it's not getting processed properly? Energy production markers, EMS, dental problems, toxicity issues, all these things affecting you. And they all have to be functioning if we're going to get you better. You know, if we correct, we give you a supplement, but we don't correct any of that. You go through chemo, we don't correct any of that. You know what? You get nowhere. You need that balanced immune system in order to get your body to stop attacking itself. You know, if it goes too low, you've got cancer. Infections, if it's too high, you've got autoimmune diseases. It's that balanced system that we want everybody to have. So how do we determine what's going on with you? The testing that we do goes well beyond your average physical. We do a complete metabolic panel, 30 basic tests. Your doctor should run that every single time. They run maybe 10. I love that. I'll get a panel that comes back. Patient's got a problem, and we see that they check you once here, once there, once here, once here. All different things, but they never check them all at once. Insurance covers that stuff every single time. They'll pay for it. It's a good test. Get it run. And it gives me so much information as a clinician to get you better. An anemia panel, iron, ferritin, B12, folic acid, inflammatory markers, CRP, homocysteine, vitamin D. There's 2 types of vitamin D. You maybe didn't realize this. Vitamin D is a hormone, which means that there are receptors in your body that have to use it. A lot of people in cancer or autoimmune disease have very low vitamin D levels. So you have to correct that. Thyroid, there are 10 thyroid tests. TSH is not a thyroid test. I want to say this again. TSH is not a thyroid test. It is a pituitary test that regulates your thyroid. But if you only look at TSH, then we have no idea what's going on. I have patients that come in, we do a lot of thyroid work in my office, and they'll come in, they've been diagnosed with thyroid cancer. Well, you know, are you at the right office for me? Can we help? It's like, well, how did your cancer get? How did your thyroid develop to that point? And that's the whole answer that we're looking for with you. We do food sensitivity testing. I use Cyrex. Cyrex Labs out of Arizona is the most accurate gluten test that exists in the world. It looks at 13 different markers for gluten sensitivity, celiac disease. It looks at 26 other foods. Coffee, corn, egg, soy, rice, potato, dairy, sorghum, millet, amaranth, tapioca. How about those gluten-free grains? If you think you're safe because you're gluten sensitive and you eat everything that's gluten-free, do you have reactions against those too? And there's actually a panel, the autoimmune panel is our newer panel. We actually have all the way up to rate 10 now. The autoimmune panel looks at 24 parts of your body could be attacking it. A big thing that we see in adult women over at age 45 is liver problems with autoimmune disease. That's a huge thing to look for, especially if we're concerned about progression of cancer or past history of cancer. So an organic acid test, so let's say that's what I do use. But what we're looking for is it could be a parasite, mold, fungi, yeast, it could be any of these other things. And you know what? We have to find what they are if we're going to get rid of them. Hormones, big area. So estrogen dominant breast cancer, obviously we're looking at estrogen as an issue. What's progesterone doing? What's testosterone doing? What are your adrenals doing? Are you stressed to the nine? Are you not sleeping? So your adrenal gland is tired. So your body is stealing hormones from estrogen, testosterone, and DHEA to shift over to another pathway. And you know what? It's like your body's stealing from Peter to pay Paul, but Paul has a gambling problem. So nobody wins. Your body's just dumping hormones down the drain. You know, there are supplements that'll help your healing. There are immune modulators. There can be, some different names that are out there. Medicinal mushrooms. We actually have our own custom mushroom blend we do. It is a wonderful TH1 support. I apologize, it tastes like beef bouillon, but it works wonderful. It really, really does that help. Beta-glucans, protocell, astragalus, echinacea, TH1 stimulants. So most cancers are a TH2 dominant immune problem. Not all. We test for that specifically. But if they are, we have to support TH1 to give you more of those natural killer cells and help your immune system support. And antioxidants are always good. There are studies that are out there. Great studies. Milk thistle, quercetin, Chinese wormwood show potential in helping to slow cancer cell growth. How about Highland 951? This is a product for ovarian cancer or cervical cancer. It is a fermented soy beverage. This will likely save your life if that is your cancer. The cost for the supplement, you're not buying it from me, you're buying it directly from them, is $100 a day. But it will save your life. Very likely. It is a wonderful, wonderful product for this one type of cancer. And it's the fermented soy beverage. It's huge in certain things. It reduces the effects of chemo and radiation as well. They've got some good studies behind it with no side effects on it. All right, so curcumin, boswellia, ginger. These are all great things. I'm not going to bother you with the pathways, We talked about circulating tumor cells earlier. Well, what do you do about them? You have this treatment. Where are those CTCs going? How do you get rid of them? You ever heard of Tagamet? Yeah, sure. If a patient is on Tagamet, I'm not necessarily taking them off of it, even though it's got all these horrible, cytotoxins and ingredients in it, because it's one of only 2 products that exist that will actually bind to CTCs and remove them. The other product we carry in my office, it's called modified citrus pectin, or Pectisol. Modified citrus pectin does the job. It binds them, it's a moleculator, and it pulls those CTCs out of the body. It actually doesn't taste like citrus. It's really, really bitter. And people think citrus pectin, think about the peel, but it's modified. It's been chemically changed, and it can be absorbed by the body. But it does show studies, prostate cancer specifically, melanoma specifically, to inhibit the spread of it. But I use it on almost every cancer patient if they test well for it. Green tea. So I told you, most cancers are TH2 dominant. Do not take TH2 stimulants, with the exception of green tea, if you test well for it. And that's something that we do with our testing in the office. Because green tea has wonderful, wonderful inhibitory effects. It will decrease those cells that affect and vascularize cancer tissue. It will starve the cancer. And there's lots of studies behind it. Lots of good studies. So how do you know which ones you need to use, right? I use individually tailored nutritional protocols in my office. Blood tests, my training. We also utilize, no 2 people are alike. Everything we do is to use these different approaches to help, and you may need this, you may need this. It's not just the testing alone that gets us where we need to be, though. We also utilize a form of kinesiology in our office. And the reality is, I can order a blood test and I can say, we may have a gluten issue, or we may have a dairy issue, but that takes 3 weeks to get back. And a lot of my patients take 3 weeks to make a change. So we use muscle testing in our office, a form of clinical kinesiology, quantum reflex analysis as a technique, to help identify what organs aren't functioning and to make immediate changes day 1 as we wait for the test to come back. It can also help me assess. A lot of patients come in, they've been on tons of stuff. We can actually assess if that stuff is working for you or not very, very effectively. And the neatest thing is it's actually, I have an issue with kinesiology. I'm not a big fan of it. I'm really not. I'm a black and white kind of guy. I've gone a little gray because of QRA and just the years, but the key thing is it's based on research published in Japan. It uses a muscle testing technique, a bidirectional O-ring test that is reproducible, and they actually have research behind it. It's proven. And for me, I like that. Because, you've got these, have you ever had muscle testing? Was it my shoulder strong? Is it not? there's no inter-examiner reliability. One doctor to the next doctor, it's not going to be good. So it gives you that ability to know what we're doing is going to work. How do we help you? We're going to detox your body. We're going to use a modified dosing approach. I'm not having you do coffee enemas or juice 20 times a day, but we have to use them if you test well for them. I use the Rife therapy. The Rife is one of my hidden weapons for cancer. It is a light therapy that has electrical waves. So it's a frequency-based. Now, I don't know if you guys know this. Everything in our body is frequency-based. You know, everything we have, I mean, anything, you know, even the water there, you've got positive and negative ions that hold it together. Science, our government, our military, has determined frequencies of almost every condition that exists. And we can attack those frequencies. The Rife therapy, it goes way back. Dr. Royal Rife developed it almost 100 years ago. And I can tell you, there were study after study after study done that said it's a cure of all disease. And literally the AMA got a hold of it, and you can guess any conspiracy theory that you want. There's some great books that are out there on it. But the therapy exists. It's not something that's talked about a lot. I guarantee you, I've seen a dog with congestive heart failure lie down and use the Rife for 3 hours, and the dog was 60% reduced in their swelling in one day. And we've seen patients with tumor cells disappear. I mean, it's something that, this is a key piece at home of helping to normalize the alkalinity in your body, to help your pH, and to get those cancer cells identified in your body so they can be killed. We use mud packs. Believe it or not, mud packing is something that's really shown over in France and in Greece. Some great research behind it to help detoxify interference fields. If you have scars, if you have tattoos or vaccine points, we can actually pull those toxins out by using detoxifying mud packs. Dental work, if you've had mercury fillings, that's a big no-no. We got to talk about it. It may or may not be an issue with you, but we test for it. If it is an issue, we got to fix it. What about just bridges, crowns? You know, and talk about infections. I mean, I have a patient who we kept coming back to her left tooth. It was a virgin tooth, never had anything drilled in it, no problems at all. Went to the dentist. She had a huge infection in the root. They actually had to replace the whole tooth. And literally, I mean, her gut has cleared up since that was removed. It's like her problems disappeared. It's so neat to see stories like that because what does the tooth have to do with the stomach? A lot. And when you see these infections driving the immune system, everything changes. I use brain-based therapy in my office. Exercise while on oxygen therapy is going to help give your cells the energy they need to function. And like I said, cancer cells thrive on sugar. And so if we can get rid of the sugar and give them oxygen, you're going to do great. What supplements do you need? Well, the testing I do is going to help me figure that out. What diet do you need? The testing we do is going to help us figure that out. All those different lab tests we do are going to help figure out what we have to do to get you better. Remember, cancer is life-threatening at first, but it's just an immune problem. And we have to address the immune system in your body to help balance out. You know, I want you guys to empower yourself. I want you to take responsibility for your health. You know, life is always a matter of choices and what you do with them. And, you know, what I'm saying makes sense to you. If you see the value in this information, you know, you may want to consider talking to me one-on-one, seeing if we can help your individual situation. You know, we know that information without action doesn't get you results. It doesn't do anything for you. I do have my staff back here with cards, just information. We do have a booth here. I'm more than happy to sit with you guys. My next talk is at 3:45, but I'm more than happy to sit with you guys and chat and see if we can help your individual situations. But I hope the information was really good. Remember, diagnosis of cancer is not anything more than just a diagnosis. What can you do right now before you meet with me? Change your diet. Absolutely change your diet. No refined sugar, no high fructose corn syrup, no soda, no red meat, no caffeine, no alcohol, no white death, white flour, white sugar, think that through. Fruit juices are going to get you. They're not good for you. Highly saturated fats, trans fats, food additives, coloring agents, preservatives, no junk food. You cannot eat processed food. When I do my GMO talk, 80% of the processed food in this country is genetically modified. Increase the amount of fresh organic vegetables in your diet. No or very limited fruits. Fruits are going to feed your cancer. Stone fruits, once per week if you have to. Peaches, pears, plums, nectarines, avocados, cherries. Those are good, but only once a week. Organic grass-fed chicken or fish. Very little, if any, red meat. Wild game, I'm okay with to a certain extent. If you think about it, it's, you know, a clean living. You're eating off the ground. These animals that do. Venison is so clean for you. Buffalo. A good buffalo is as healthy for you as salmon.
you think about it, it's red meat, you think about it, but it's not often, you don't want to eat it often because of the alkalinity issue, but as far as the nutrients in it, there's not a lot of problems there. Also, no CoQ10, no glutamine, no glutathione. That will drive your cancer. And detoxes are great. Massage, sauna, steam room, distilled water, foot baths, those are all fine. The ionic foot bath, any of those things, if you've done those, keep doing them. Vitamin D, get in the sun at the very least, and then we'll sit down and we'll talk about your vitamin D doses. Be careful, sometimes taking 2,000 IU, 5,000 IU is not enough. I have a colleague of mine who runs a psychiatric institute in the Midwest. Every single one of his inmates, every single one goes on 10,000 IU vitamin D. They need it. Daily. Every day. Dr. Kelly, metabolic-typing.com. Modified citrus pectin is something that you can do right away. It removes glycan-3 proteins. We buy it from Pectisol, is the name. Econugenics is the company. I think Elliot is a huge integrative medical practitioner. He's one of my instructors in the fellowship. Modified citrus pectin would be a multi-billion-dollar drug that could be patented by drug companies. It can't be. If not now, when? Thank you.